them is entirely appropriate.
Minister, have you spoken to Mr. Park about that video?
No, I haven't. This was only brought to my attention literally 10 or 15 minutes before we started this press conference. I have had his comments put in front of me. I entirely endorse them.
Should health workers taking similar action be stood down across the country if there are more instances of this kind of behaviour?
Well, let's go back to first principles. It has been a core principle in healthcare, not just in Australia, but for a very long period of time, for centuries, that you treat whoever comes before you. You do no harm and you treat whoever comes before you, no matter what their race, their creed, their religion. That is just so core to the delivery of healthcare and the professional ethos of the wonderful doctors, nurses, health professionals that we have in this country. The idea that a couple of health professionals would say that they refuse to treat someone because of their race or because of their religion runs contrary to the most fundamental principle of healthcare.
Minister, when will the government announce a decision on private health insurance premiums? Will it be before the caretaker period ahead of the election?
I'm very confident it will be before the caretaker period of the election. I have written back to some of the insurers only, I think, very late last week from memory, asking them to resubmit their applications for premium rises for 2025. From memory, I asked that that response be delivered late this week or very early next week, perhaps. So I think I'll be in a position to make that decision relatively soon. I want to make the decision as soon as I possibly can so that insurers are able to put in place arrangements and members are obviously alive to what is happening. I'm sorry, division has been called. Did you have a really hard question?
It's a quick one.
Yep.
Doctors have proposed a $1 billion expansion of bulk billing. Will the government announce measures for patients other than children and pensioners?
The College of GPs and I talked very closely in the lead up to our landmark decision to triple the bulk billing incentive. They described it as a game changer when we did it, and it has turned around bulk billing in general practice. I'm in a terrific discussion, not just with the college, but with the other organisations here about what else we can do to strengthen Medicare, because the Prime Minister and I have said that although what we have done has made a meaningful difference, of course there is more to do. Thank you.
Thank you.
Thank you.